Right, let's go to this now. Do you know that some childhood cancers are treatable with a success rate of between 70% and 80%? But that's only possible in well-resourced countries. According to Cansa, 80% of children with cancer in Africa die without access to adequate care. You too can do your bit to help, and today is of course Sunflower Day, 15 September, a day that's dedicated to raising awareness and money for children with blood cancers. Joining us to discuss how you can help is Palesa Mokomele, Head of Communications at DKMS Africa. Thank you so much, Palesa, for joining me this evening. Of course, you know, it is Sunflower Day today. How are you and your organization, of course, setting your goals to make sure, you know, that children not just get the necessary help, children with blood cancers, but also the funding that they need?
So in order to help children who need a life-saving stem cell transplant, we have a patient fund that is available. We work primarily in state hospitals where we have partnered with a US-based registry to make available funds, particularly for children who find a stem cell transplant, but where it's an unrelated donor. In South Africa, the state only pays for a related donor or only transplants a related donor. But more than 70% of patients who are diagnosed with blood cancer find a stem cell transplant outside of their family.
And, you know, how do you then encourage people to donate? Have you seen an increase over the past few years of donors, or would you like to see more people come to the front and actually make an impact and a difference?
So only 0.4% of the South African population that is eligible to register to donate is registered. So we still have a very long way to go. But what's been really encouraging for us at DKMS is that there's been a huge uptake within the black-colored Indian community over the last couple of months. Particularly in universities and in corporates, we've received a lot of invitations to come. I think people are more aware as we create awareness, we educate people about the safety of the process. And I think also as we start to put a face to blood cancer, because a lot of us don't know anyone who's had a blood cancer. It's not a cancer that you can see that's visible to the eye. But we've done a lot of awareness, and we've partnered with well-known South Africans. We are a global organization, so we also have capacities outside of South Africa to also work with other international partners in order to bring a face, to bring awareness, and to also help to help patients to find a donor.
Palesa, you mentioned now, you know, you've seen an increase when it comes to the Black, Indian and coloured communities when it comes to donating and you know, being donors, which is, of course, a great step in the right direction because, of course, we know historically there has been some barriers when it comes to POCs in this regard. What are some of those barriers and why do you think they exist?
Some of the barriers have to do with just general awareness. I think it's a historic thing where educational resources were just not driven to our communities. We have some barriers with regards to the safety of the process. That's obviously a main thing, and I think you can see that across different races. So what happens to me after I've donated? Am I safe to donate? The other one is also quite common. There are some misconceptions about how the stem cells are actually removed from the body. And I do want to emphasize that it's very safe. It's a non-invasive process, actually. So we don't drill into any bones. Technology has allowed us to get the stem cell into the surface of the blood, and that's how the stem cells are removed from the blood system and separated from the blood.
I think, you know, it's good that you mentioned that part because I think a lot of people don't understand. They're not educated enough on, you know, the process involved in being a donor and donating stem cells. Maybe also when it comes to men, I know you've done some research on that as well. Maybe emphasize the importance of early detection, of course, when it comes to blood cancer, particularly in men as well.
It's so important. I think across all cancers, early detection means better results in terms of treatment. With blood cancer, I'd say that people who need a stem cell transplant generally just need a donor. So there are other therapies that the doctors would recommend, but when you need a stem cell donor, you need a stem cell donor. I think when people start to feel, fatigued for no reason, your joints are aching for no reason, unexplainable reasons, particularly among children, if a child falls and their wound just doesn't close, or some kids just experience a fever, won't stop crying. Sometimes parents will know, they'll get an inkling that there is something wrong with their child. I'd say that if you're not sure, go to the doctor. And also, another important thing that I've experienced is that you need to advocate for yourself as a parent and as a patient. If you feel there's something wrong, you need to give me, I would like to get more tests taken, because patients who have been diagnosed sometimes experience very common things, or they experience very common things that can be very easily dismissed. So advocating for yourself is extremely important.
And then very lastly, how important is it also for young people to become donors?
It's extremely important for young people to become donors. I mean, the stem cells are quite young and fresh. You can donate from the ages of 17 to 55. I think also with young people, you have a more receptive audience. We found in universities that young people are more willing to engage with the topic. They are more kind of vibrant. They want to know, they want to help out. And they don't have many preconceived ideas about, cultural beliefs or religious beliefs even. They kind of want to do something good for someone else, and they want to give someone else a second chance at life, effectively.
All right, thank you so much. That was Palesa Mokomele, Head of Communications at DKMS Africa, of course, also formerly known as the Sunflower Foundation. A very important work that they do, of course, raising awareness, but also getting funds for especially children that are diagnosed with blood cancer.